Welcome to the Compliance plus Ethics equals Integrity podcast, which features BerryDunn Healthcare Practice Group professionals and expert guests discussing their insights into contemporary as well as perennial healthcare regulatory, revenue integrity, general compliance, and risk management topics. My name is Robyn Hoffmann. I'm a senior compliance and credentialing manager in BerryDunn's Healthcare Practice Group. I am very pleased to be joined for this episode by two colleagues from BerryDunn, Senior Manager Denny Roberge and Manager Rego. The title for our podcast is Implications for Revenue Cycle Operations as the COVID-19 Public Health Emergency has ended. Before we get into our discussion, a quick disclaimer. The content we discuss in this podcast is based on our professional experience advising healthcare providers, facilities, and other organizations that engage BerryDunn for compliance and other services. While we may reference specific government programs, Medicare and Medicaid policies, and regulatory guidance, we do not speak for any government agency or contractor, nor do we have the authority to do so. Nothing in this podcast should be considered legal advice. Anyone seeking legal advice on the subjects we discuss should consult their own attorney. So now it's my distinct pleasure to introduce my colleagues. I'll start with Denny Roberge, who is a recognized subject matter expert on revenue cycle and patient access transformation, revenue integrity program management, and back-end revenue cycle redesign. Denny, you've been called upon to share your revenue cycle expertise with various chapters of the Healthcare Financial Management Association and also with the Mid-Atlantic region of the National Association of Healthcare Revenue Integrity. I have to say, I just loved the title of your presentation to the NAHRI, which was The Kinetic Revenue Cycle. We are incredibly fortunate to have you join us today, Denny. Can you please share some additional highlights about the types of services that you offer here at BerryDunn?
Sure, Robyn, and thank you for that wonderful introduction. So here at BerryDunn, we work on a lot of great projects and working with our clients and optimizing all parts of their revenue cycle, focusing on the three legs that really make a difference when you're looking to optimize, right? People, process, and technology. So we help implement, new EHRs, new clearinghouses, new patient access tools, such as authorization management tools, registration quality. But our focus is always on how do the people and processes come together to create a best practice revenue cycle. And with today's challenges, which is no shortage of, all three of those components have to be working together to really drive those success and those metrics where we need them to be.
Thank you so much. And now it's my pleasure to also introduce my colleague, Rego. Roger, you bring BerryDunn over 30 years of experience from the not-for-profit healthcare sector. You've worked as a chief financial officer in a federally qualified health center. You've worked in hospital settings. And in addition, you've actually worked for Medicare and for TRICARE. We are thrilled to have you join us in today's podcast. Could you let our listeners hear a little bit more about the types of services that you offer to BerryDunn's clients, Roger?
Yes. Hi, Robyn. Thank you for the introduction, and it's great being here today. Some of the things that I work on specifically is in interim management, where we go in and help organizations and fill the gaps that they have while they're trying to recruit different management positions. We also do a lot of the things like what Denny was saying, but even getting into more granular looks, we break down into our denials and try to help you identify, the denial issues, where it's coming from. Same thing with front end and middle coding. Just taking a look at all those areas and trying to optimize and try to come up with a good product for our clients.
Thanks so much. As we were preparing for today's podcast, Denny, I saw you were the author of what was a really wonderful article for BerryDunn which was published back on March 12th, 2020. And the title of that article was Preparing Your Revenue Cycle for the Pandemic, COVID-19. Can you believe? Here we are. Now the pandemic has finally ended. With the end of the public health emergency and the unwinding of Medicaid continuous eligibility, can you give our listeners some examples of the impacts on what we at BerryDunn refer to as the air quotes schedustration segments of revenue cycle? I just love that term, schedustration. Can you describe that one to our listeners, please?
I can. I say it's hard to believe that, the pandemic is over and that it was, only 2020 when it began. Certainly a lot has changed in terms of, the healthcare landscape, from the payer side, provider side, all throughout it. Like I said, it's been a really challenging time. But when it comes back down to it, right, when we think about our revenue cycle and the challenges that we had pre, post, and during the pandemic, we've always had the issues, and continue to have the issues around making sure that we're getting the right demographic and insurance information so that we can bill correctly, eliminate denials, eliminate patient frustration from getting bills that they don't deserve. And when you talk about schedustration, that's really combining of two processes that are often disjointed, right? The scheduling event and the registration event. And, there's plenty of different ways you can structure a revenue cycle, on intake area. But ideally, you really can't start a good financial clearance process unless you have the basic information you need. And the best time to do that is when you have the patient, in need of a service and on the phone. It's just a scheduling event, right? So when we talk about schedulestration and those type of things, it's really combining that schedule event or the earliest event possible in your revenue cycle to start getting the information you need to start processing that patient. And by processing, I mean verifying that, in fact, the information they gave you from the insurance company is correct. From there, if there is a patient balance, making sure that they're aware of it, having those discussions, if they qualify for charity care or other programs, assisting them in finding that. If the service requires an authorization, I mean, that's really the stuff, right? The time to do it is as soon as you can start really working on that patient, which is the scheduling event most of the time. And again, sometimes even at an ordering event, you can start the same process. But to your point, now that we're in this post-pandemic era where we've got a new challenge, right? The Medicaid eligibility criteria are rolled back now. So it comes back to you're not going to get paid if you bill the wrong insurance. And if a patient doesn't have the means to pay, you're also not going to get paid. So really looking forward, or backwards, I should say, in the revenue cycle continuum to really make sure you understand that patient's financial obligations, what they have for insurance. If they just lost their Medicaid, well, what is available to them? And if the only thing that's available to them is charity care, enroll them in the charity care programs. That's what they're there for, right? Or in the FQHC space, the sliding fee schedules. That's what's best for the patient. And it's also what's best for your revenue cycle. So you're not spending time and effort trying to find dollars that aren't there, right? And so again, this is where getting it right up front really makes a difference. And so schedulestration, orchestration, whatever you want to call it, as soon as you can start getting that information and clearing that patient, it's essential. And like I said, right now we've got that new challenge because a lot of insurances are changing to a very vulnerable population. So great question, Robyn. I appreciate that.
Thanks for your wisdom on that. I really do appreciate it. And, I'd like to turn to Roger now, who has worked as a CFO in a federally qualified health center. And I'm wondering should there be any changes in the design of a healthcare organization's internal reports due to the unwinding of the Medicaid continuous eligibility? I'm just wondering, would there be a need to maybe increase the frequency of generating internal reports to identify whether your organization might be heading towards some losses in reimbursement? I'd really love to hear your perspectives on this, Roger.
Yeah, thank you. I would hope that prior to the pandemic that organizations were using reports and doing management of their denials or through the revenue cycle. It would be kind of scary if they weren't, and now all of a sudden they're trying to figure that out. But, with this ending of this emergency and, the Medicaid coming out now, it's even that much more important because we've had the last, 2.5, 3 years where Medicaid was much more available to people. And now with that rollback a little bit, it's going to really, make a demand on the whole revenue cycle, but, especially in the back end, because like Denny said, it's very important to get all that information up front. Well, we know that there's times where that doesn't happen, or there's organizations that struggle with that. Then the responsibility comes to the back end is who is seeing it. Unfortunately, by the time they see it, it's late, and, especially in the Medicaid world, if a person lost Medicaid, maybe that patient doesn't even realize it, that they lost Medicaid. And depending on what you're doing, they might come in with a Medicaid card to show that they're eligible. But, as we talk about it, it's important that not just one person or that your billers are the ones watching for denials. You want a team to be meeting on a regular basis. So that would encompass reports from both your system and also some other technologies that, are out there for working denials management. Bring a team together that has the whole revenue cycle, your patient access, coding, your departments, your IT, your business office, and work through those reports as a team and take a look at what's causing your denials. And like I said, with the Medicaid piece, now with that being pulled back, there's going to possibly be more opportunity to see denials increasing on the Medicaid side, which, again, if you're not being proactive at it or not getting your patient signed up for charity care or sliding fee scales, it's going to be hard for collections, and it's just going to be hard for the organization.
Yeah, I love what you said about the team approach. And it takes me back to, I was in a healthcare organization. I was in a federally qualified health center during the pandemic. And certainly the use of what we called huddles from a clinical standpoint, that we would have, very brief huddle calls across the organization to really help to guide our work, if you will. And I think that model is something which, definitely, as you're talking about the need for people to work across departments to really make sure that the information is being taken in and addressed if there are needs for any modifications in that schedulation process, for instance. And, I'm wondering, Denny, because you are so knowledgeable about electronic health record systems, I'm wondering whether there are ways by using an organization's EHR, whether they can help to inform their established patients who have Medicaid coverage about that unwinding process. There may be people that think, oh, gee, I still have Medicaid. So is there any way that the EHR can be used to help to inform patients about these imminent changes?
Yeah, so the good thing with the EHR technology is most every one of them has integration to and from the payers, the 27X responses, right? So it can bring you a lot of information about their eligibility, term dates, and so forth. And again, the best practice to me has always been start financially clearing the patient ahead of time, as I mentioned sooner. And this is where the EHR can come into really to be the tool of, real value, right? If you set up your EHR correctly, and if your EHR doesn't have the functionality, there's plenty of bolt-on companies that can assist, and the value of it is well worth any cost. Because what you do is you create a workflow where as soon as a patient schedules, you start verifying their benefits. And at that point, you'll know if they're going to be eligible or not for their upcoming visit. And you use that response to then reach back to the patient and start either the charity care process, sliding fee process, and or enrolling them in an alternative plan, right? There's a lot of different ways you can reach out to a patient. And the other thing, with these tools and technologies and workflow is you can be assured that if you follow the right workflow, that patient has coverage and that you're not going to have any issues on the back end, right? That they're registered correctly. So to me, the EHR is absolutely most everyone has this technology and workflow in it. And if not, like I said, it's worth investing in a bolt-on technology to supplement, any gaps in that workflow and process. But those processes can be heavily automated so that your team is only looking at the exceptions. So if I register and I'm good, I'm green, you don't have to worry about me. the technology has told you that I'm good to go. If you come back red, it tells you that no matter what you do on the back end, you're not going to pay. You're not going to get paid because the patient's registration is incorrect. And those are the ones you should focus all your effort on. So big advocate of setting up the workflows within your EHR. And to me, that is the only way you can efficiently and effectively create a best practice front end.
Thanks. And Roger, I'm wondering if you have any thoughts about this in terms of ways that healthcare organizations can inform either their established patients or patients who I would say are new and are shopping for a new primary care provider about the unwinding of Medicaid. Are there ways that you would recommend that an organization can take action in addition to all of the EHR opportunities that Denny has offered us?
Yeah, I think one of the areas, depending on your organization, is that within your EHR, you can run a report that lists all your Medicaid patients. So, we're talking about established patients. So you could sit there and go through that report. And I mean, really, if you wanted to, you could do an eligibility check on all the people who are established patients. And if you identify people who have lost Medicaid, instead of waiting for them to come in, you can actually start reaching out to them now. And then that way you're going to be able to change, what's in their demographics. And they're going to be pretty happy that you're contacting them to walk them through the process. So you want staff to be educated on Medicaid and what this all means and the changes that are happening, and be able to explain that to the people ahead of time. And I think that if you do that with your established patients, I think you just build that relationship. You see that a lot in FQHCs, where FQHCs are reaching out to their patients for a lot of different things. And I think this is one of those areas that'd be really critical to be doing that. For new patients, if they're out there looking for a new provider, ways that you can sit there and let them know about the changes in the emergency and Medicaid is going and using your website, using Facebook, using Twitter, any other means that you have to reach out to patients or to post things. And you can actually give education about the changes that are happening. And I would recommend that for anything that comes to changes within your organization that impacts patients, because even your established patients are going to look at your website. Sometimes they're going to make an appointment there. Sometimes they're looking to see what specialists there are. So, I mean, it's a great way to educate patients on the different changes.
That's great, Roger. And I know Robyn was just asking previously kind of our final thoughts around when we come to the end of the pandemic now. What are the things that we think that organizations should be looking at and doing? And, there's been a lot of change, as we mentioned earlier, since the pandemic began. And those changes are things that we learned to adapt quickly. We learned to respond to things. And those skills we learned, I think we have to make sure we keep them sharp and continue to focus on, the commercial in the government regulations, because the commercial payers are probably going to start pulling back on a lot of different things that they allowed around telehealth and coverage type things. So you really want to make sure you're monitoring your commercial payers, monitoring Medicare, because I think, we're in a new period, but I think rapid change and the kind of change we've seen in the past, it's here to stay. And it's going to be upon us as providers to stay on top of things. And we have to be proactive and not reactive if we really want to make sure that our revenue cycles are healthy. So I guess those will be my parting words. Like, just keep up the nimbleness and willingness to change, and be prepared. Look out for those needs to change, and be proactive. And I think those are going to be the guiding strengths that help you and your organization succeed and remain strong in the future months.
Yeah, that's great information, Denny. And kind of to follow up with that, it's really working as a team because, as you said, we need to stay ahead of things, but you can only do that when you're working together. Because if one department identifies something and they're not talking to anybody else, it's just not going to work.
Yep.
So it's really important that you pull together a team, that you're working together as a team, that you're working together as a revenue cycle. That's the whole idea of the revenue cycle. We're all working together, front end, middle, back end. It's all the same. So it's, really the key piece is just keep working together and stay on top of it and just watch for changes. And when you identify changes, get it out to everybody in the organization and make sure that they're aware of it.
I guess the moral of the story is the things that make a best practice revenue cycle before, during the pandemic they still hold today, right? And maybe even more so because there's a lot more change and a lot more things we have to keep our eyes on. So I think that's been great. So thank you, Roger, and thank you again, Robyn, for having us as part of your panel.
Denny and Roger, thanks again for sharing your insights. We've reached the conclusion of our discussion about the impacts of the close of the COVID-19 public health emergency on revenue cycle operations and the so-called unwinding of the Medicaid continuous eligibility provision. We thank you for listening to this episode of BerryDunn's Healthcare Insights Compliance plus Ethics equals Integrity podcast. We welcome our listeners' questions and feedback about the ideas we discussed in this episode, as well as suggestions for topics that we should consider developing for future episodes. Thanks again.